Hello friends, let us now learn some important points about indirectly acting sympathomimetics. These will increase the release of noradrenaline in synaptic cleft or decrease or inhibit the reuptake of noradrenaline. First drug is Tyramine. Tyramine is present in certain foods. So Tyramine combines with monoamine oxidase inhibitors and it can result in cheese reaction. The cheese reaction, drug of choice for cheese reaction is phentolamine. Then we have methylphenidate. The next drug is methylphenidate. This is preferred in ADHD. The other drugs used in ADHD are amphetamine, atomoxetine, then the drug pemoline. This pemoline is withdrawn from the market due to life-threatening hepatotoxicity. So the next drug, third drug is amphetamine. Amphetamine is actually an addictive substance. It is an addictive substance, amphetamine. This amphetamine gets converted to this amphetamine is a basic drug. So we have one important use of amphetamine amphetamine being a basic drug, this is used in the urinary acidification with ammonium fluoride. Ammonium chloride is employed in its toxicity, because if there is any toxic effect of amphetamine, if there is amphetamine is given in excess amounts and it resulted in toxic effect, then amphetamine, as it is a basic drug, we can rule out or we can decrease its concentration by urinary acidification with sodium chloride, which will cause excretion of amphetamine. The next drug is Modafinil. This Modafinil is approved for the treatment of narcolepsy in shift workers. This Modafinil also will relieve fatigue in multiple sclerosis. It relieves fatigue in multiple sclerosis. Modafinil is also used as adjunct in obstructive sleep apnea. Then the next drug which is important, the next group of drugs are mixed action sympathomimetics. Mixed action sympathomimetics. These mixed action sympathomimetics, these will release noradrenaline indirectly. Example being ephedrine, pseudoephedrine, which are used as nasal congestions. And this ephedrine is used in the treatment of bronchial asthma, and this is a vasopressor of choice in pregnancy. So these are the important points about the mixed sympathomimetics and indirectly acting sympathomimetics. Thank you guys for watching my lecture. Thank you.